Hello, Senator Nickel. My name is Ruth Austin. I've been a nurse at Wake Med on a medical surgical unit for about 2.5 years now, and I am one of your constituents. I would love to talk to you today about the SAVE Act, which would allow advanced practice nurses to practice independently without physician oversight and to their full scope of practice. First, it is important to understand why this act is so important to North Carolina. Given the current situation with COVID-19, the limitations and flaws of North Carolina's healthcare delivery system have been exposed. We lack adequate access to primary care throughout the state. Consequently, individuals resort to using the emergency room for their primary care. This adds unnecessary risk, slows down the delivery of care, and increases the overall cost of healthcare. We need to take action now. This leads us to the SAVE Act and the goals of this legislation. Currently, both the North Carolina Medical Board and North Carolina Board of Nursing regulate advanced practice RNs. The SAVE Act proposes that the NC Board of Nursing solely regulate advanced nursing practice. Furthermore, the SAVE Act would remove the requirement of a collaborative practice agreement for advanced practice RNs. According to the American Association of Nurse Practitioners, only 12 states, North Carolina included, require physician oversight and heavily restrict practice. Eliminating this requirement is not a new concept and has been implemented in other states, such as Colorado, Washington, and Maryland, just to name a few. Let's talk about the many benefits of this change that other states have already experienced. The first benefit is cost reduction and economic stimulation. In 2015, Christopher Conover and Robert Richards conducted a study with Duke University to evaluate the economic benefits of less restrictive regulation of advanced practice RNs. The study estimated that the SAVE Act will save North Carolina between $433 million and $4.3 billion per year. The Act would also create more than 3,800 jobs in North Carolina. That's significant. The second benefit is increased access to health care in North Carolina. Access to health care is composed of many factors, including location, travel, cost, education, health literacy, and language barriers. The SAVE Act has the potential to address all these factors. For example, increasing the number of nurse practitioners working throughout North Carolina and eliminating the cost of physician oversight will make primary care more affordable. Increasing the number of advanced practice RNs in rural communities would address location and travel barriers. Improving access to health care would also help improve health literacy, as a large part of nursing care is educating patients, families, and communities. There is opposition to the SAVE Act. Some argue that advanced practice RNs don't have enough experience or education to provide quality care. However, there are many studies, including one conducted by the Institute of Medicine, that indicate advanced practice RNs are able to provide safe, quality care without physician oversight. The requirements for supervision may be surprising to you. Physicians do not have to be in the same physical location and can supervise multiple physician extenders at once. They simply need to be accessible through technology, so simply a phone call. But they can be in different states. Furthermore, the NC Board of Nursing explains every 6 months there shall be scheduled meetings between the primary supervising physician and the nurse practitioner. These are very minimal requirements and do not add additional safety parameters. Eliminating the collaborative practice agreement would not compromise patient safety or quality of care, but rather eliminate excess cost and waste. Opposition comes from many physician groups and organizations that recognize how the SAVE Act will impact billing practices. Physicians are able to supervise many advanced practice RNs and PAs at once and actually bill for services rendered by those physician extenders. So eliminating the collaborative practice agreement would eliminate a source of payment for many supervising physicians. So there's the bottom line. We need to take control of the waste in our healthcare system in North Carolina. The SAVE Act is the solution that will decrease costs and improve access to health care. Senator Nickel, you have recently supported efforts to give Medicare the ability to negotiate drug prices and decrease costs for Americans. The SAVE Act aligns with your core belief that health care should be affordable to all. I implore you to take action and to advocate for this just cause. Thank you for your time.